Appropriate use of empirical and anecdotal evidence in REBT. REBT, often but not always, disputes dysfunctional cognitions, that is, those cognitions that tend to yield behaviors and emotions that tend to inhibit a client from living out of their values and reaching their desired life goals, both short-term and long-term. The two major types of cognitions that are explored in REBT are inferences and beliefs, where inferences are cognitions that attribute meaning to a situation or event, and beliefs are cognitions that don't attribute meaning but do evaluate a situation or event. Disputes of cognitions take many forms, including pragmatic, empirical, logical, friendship, and more. Clients, and some therapists, confuse empirical disputes. The confusion is due to conflating empirical with anecdotal evidence. What is the difference? Empirical evidence and anecdotal evidence are two different types of evidence that are used to support an argument or a claim. Empirical evidence is data that have been collected through logical observation, experimentation, or measurement. Anecdotal evidence is based on stories or personal experiences. Empirical evidence is considered to be more reliable than anecdotal evidence because it can be tested and verified. It also provides objective information that can be used to draw conclusions about a certain phenomenon or event. On the other hand, anecdotal evidence is subjective and relies heavily on the credibility of the person providing it. It is often used to support an argument but cannot be used as concrete proof of something. For example, if a client believes the self to be a failure, empirically there can be no evidence that the client is globally a failure. Objectively, if one sticks closely to the data, the most one can legitimately conclude is that the individual failed at something or several somethings. Subjectively and anecdotally, the individual can move away from the data and conclude that the self is a failure. So, what should an REBT therapist do? Of course, we listen very closely to the subjective meanings and conclusions the client sincerely makes, especially because those subjective meanings and evaluative conclusions may get in the way of the client experiencing the life they want and reach the goals they desire, as a life based on the treasured values of the client. Therefore, as best we can, we, with the approval of the client, collaboratively work to base conclusions on objective data to better help the client live the life they desire and face life's challenges with hope and determination. The client's anecdotes are tremendously helpful for a therapist to understand the client's perceptions of the self, others, life, and the world, whereas empirical data help the client to perceive and act upon perceptions as resources as they better navigate life. Both anecdotal evidence and empirical evidence have important places within REBT if given their proper significance in therapy.